Dr. Dave Seftow for Macular News, and I'm here today with Dr. Simon Clark from the University of Manchester. Welcome.
Welcome, thank you.
Dr. Clark, tell us about your research that you presented at ARVO 2014.
Well, my main interest is the regulation of the innate immune system, mainly by complement factor H. And I've worked on that for a few years now in relation to age-related macular degeneration. But recently, it's come to our attention that there's other proteins which seem to be playing a role in this form of regulation, like the factor H-related proteins, these extra proteins, and the factor H-like protein 1. So I'm particularly interested in how they play a role in immune homeostasis in the back of the eye. And the data I'm presenting here at ARVO this year suggests they play more of a role than perhaps we had originally anticipated.
And what is that role?
Well, it would appear that the smaller, the truncated form of factor H, called factor H-like protein 1, may be able to penetrate the Bruch's membrane a lot more easily than the full-length protein. Now, what that means is that it's actually able to reach the site of disease pathogenesis and is likely to be the form of regulator that's actually protecting the Bruch's membrane. What that means in terms of understanding the biochemical process is that we have to sort of reconsider all the different interactions that we've already studied to date, because we've always made the assumption it was the big protein that we were looking at, but in fact it may well not be.
What is the size of the proteins that we're looking at?
Well, the original factor H protein, the big one's 155 kilodaltons in size, and I should say is glycosylated. However, the smaller proteins range in size from about 39 to 50 odd kilodaltons. FHL1, for example, is 49 kilodaltons in size.
What do these proteins actually do?
Well, there's not an awful lot known about what the FHR proteins do, the factor H related proteins. There's a hypothesis that they are evolutionary offshoots and they get in the way, essentially. But more commonly, we're now looking at them as positive regulators of the complement cascade, so they will compete with factor H or FHL1 for binding sites, and there's this of immune homeostasis. There's this nice balance of immune regulation on the Bruch's.
What are the implications for potential therapies?
Well, it's incredibly important to understand the biochemistry of immune regulation at the site of disease pathogenesis. Once you know that, you can identify the targets, you can identify how the immune system's interacting with that part of the eye. And if you know that, then you've actually got something to develop a therapeutic against. So it's incredibly important to know this.
So essentially what you're doing is opening up new doors for potential therapies that weren't available before.
We would like to think so. That's what we're aiming to do, just to understand exactly what's going on. Quite how one would go about developing these therapeutics, well, that's for others to decide and try out. But yes, hopefully we're opening some more avenues of investigation.
So the specific poster that you presented at ARVO today, this year, tell us about that.
Well, so this poster showed that the main regulator of complement on the Bruch's membrane is this FHL1 protein. We developed specific antibodies against the unique C-terminal peptide of this protein, and we believe that's the first demonstration that it's by far and away the most important regulator there. Factor H is there, I should stress. I mean, it's not the be-all and end-all, but it's not quite as clear-cut as we may have thought, and that's incredibly important to know. People have already thought that the FHR proteins outcompete factor H for binding to the Bruch's, but of course they may well have different properties against the FHL1 protein, so we'll have to investigate what they do now.
Tell us about the direction that your research is likely to take based on the work that you've presented here.
Well, I think we will focus more now on the FHR proteins to fully understand exactly what they do. Again, most of it's conjecture and hypothesis, because up until now nobody was particularly interested. We just assumed they were just floating around and getting in the way. But now that it looks like there's a much more specific interaction, we'll purify these proteins, we'll recombinantly express them, and measure their biochemical interactions. So I think that's where the lab will be heading.
When we look at the grand map of the pathogenesis of macular degeneration, do you believe that your particular research will change the direction?
I think it will. I should stress that I don't believe the mutations in the factor H gene cause AMD by any stretch of the imagination. I do think, however, what they do is they make you more susceptible to the disease. So even if you had the protective haplotype, you're still potentially going to develop AMD when you're much older or later in life. However, if you have the risk haplotype, all that does is it just tips the balance of immune homeostasis too early, and so your eye may be able to deal with this immunological insult, but just far less well if you have the risk allele.
Are there any particular populations that are more susceptible to this mutation?
Well, the mutation occurs more predominantly in individuals of European descent than they do of, say, African or Asian descent. So there's approximately 30% of everyone from European descent has at least one copy of this mutation.
Does this make people susceptible to other vulnerabilities?
Well, rather interestingly, it doesn't appear to manifest itself in other conditions, nor in other parts of the body, which is quite interesting. There are mutations in another part of factor H which affects the kidney, but again, interestingly, not the eye. But there was a hypothesis laid out before that this mutation would actually confer protection against invading bacteria, because bacteria recruit factor H from your blood supply to evade your immune system. And if this mutation stopped factor H from binding this bacteria, they would get killed off sooner. So that's the hypothesis put forward as to why it's so prevalent in the European population.
So that may be an evolutionary step.
Yes, in fact, there was a Dr. Robert Avery, I think the gentleman's name was, from the States, who hypothesized it was actually Yersinia pestis that this affected, which of course was responsible for the Bubonic Plague, which wiped out swathes of the European population in the Middle Ages. And in fact, his argument is, if you compare the incidence of the polymorphism in a population with the incidence of the Bubonic Plague during the Middle Ages, they coincide reasonably well.
Well, that's very interesting. Is there anything else you'd like to add about your work and about the future of macular degeneration research? Well,
I think it's a very exciting time at the moment. I've seen especially here at Alva, I've seen an awful lot of very exciting bits of work. It's nice to know that we're all working on the same thing together, and there's a clear definition from the bench side, from basic scientists such as myself, working at the nuances of the biochemistry, but also there's the clinical side, and it goes all the way through. And so long as it reaches the clinic at the end of the day in the patients, then ultimately that's what matters.
What would your message be to millions of patients suffering with macular degeneration in terms of the timeline that your research might possibly bring benefit to them?
Well, I think it will make an immediate impact on the direction of research into AMD treatments, most certainly. With regards to how fast a treatment may come about because of it, I think it's very difficult to say. I don't want to sort of unduly raise anyone's hopes, but I can certainly say it'll affect the direction of the research.
Well, thank you for your great work, and I appreciate the interview. Dr. Simon Clark.
Thank you very much.
Very good. Are we wrapped? Excellent. That was great, Simon.